Now at 8:41, and a new report from the American Cancer Society shows overall cancer deaths are down in America, but cancer rates among certain groups are still high.
Yeah, the report shows cancer risk is higher among young adults, and women surpass men for some cancers. Our 9 Health expert, Dr. Coley, joins us now to discuss the new findings. Thanks for coming in.
Good morning. Very alarming report.
It really is. So tell us a little bit more about the report.
Yeah, so cancer has always been thought of as a disease of aging.
Yeah.
You know, as we get older, our cells get old, they make mistakes when they replicate, and that's how you accumulate cancer. What we're seeing now is a trend away from older to younger people, and interestingly, away from men to women. So it used to be in the 90s, men have a much higher risk of cancer, and now young women actually have an 82% higher incidence of cancer compared to young men.
Why is that?
Yeah, so it's for reasons we don't completely understand, but we think that there is a lot of environmental reasons why people are getting cancer. So we used to think cancer is just bad luck, bad genetics, but now we're seeing it's actually our lifestyle choices. In fact, half of cancers are thought to be linked to our lifestyle choices, like alcohol consumption, which is linked to 7 cancers, being obese, which is linked to 13 different cancers. And then for us here in Colorado and other states, radon and air pollution, which is also thought to be linked to cancers.
Which cancer is rising in younger women?
So breast and thyroid. And that's what's really interesting. It's these hormonal types of cancers that we see at a higher rate. So we think it has something to do with the way that our body is reacting, the way that our hormonal environment is occurring. And we don't exactly understand why, but young women have a much higher risk of breast cancer now, even in their 30s. Breast cancer used to be a postmenopausal cancer. And now we're seeing a lot of 20, 30-year-old women being diagnosed with breast and thyroid cancers.
Well, I think that's really interesting too, because a lot of the times insurance doesn't cover a screening for people that young.
Not only that, Jordan, when you walk into the doctor's office and you have a lump in your breast and you're in your 30s, most of the times they're going to say, nah, it's probably nothing. So even the mindset of the medical community in terms of how aggressively to test and diagnose younger women coming in with masses or abdominal symptoms or weight loss or anything else, the first thing you don't think of is cancer. It's the 7th or 8th thing. So I think we really need to start changing our mindset in the medical community, not just about coverage, but also about how aggressively we test our younger people, knowing that we're now exposed to more risk than ever before.
I mean, obviously this is scary to think about, but does this mean that more people are dying from cancer?
So that's the silver lining of all this. We're overall diagnosing more cancers, but the cancer-related mortality overall has actually gone down 34%. And I think that's better screening, better awareness, better therapy. So we have something called immunotherapy, where we're now using the immune system to attack the cancers. We do a lot of genetic analysis on cancers as well, where we look at your cancer and kind of create a genetic map to try to figure out how to fight it. But there is a subset of cancers like pancreatic cancers and others, mostly the ones linked to alcohol, where the mortality has actually gone up. Just because, you know, if a woman drinks an alcoholic beverage because of her smaller body size and because of the way her body reacts to it, she's more likely to have cancer from it. And similarly, if a woman is heavier, for example, an obese woman, she's 2 times as likely to have cancer from being heavy as an obese man is. So for women in particular, I really worry because it's the same risk factors that men are exposed to, but we get a bigger whammy out of it, so to speak.
Very interesting.
Truly.
Scary for sure. All right, Dr. Coley, thank you so much for coming in. And you can find all of Dr. Coley's appearances on our website, 9news.com/Dr. Coley.